We're diving into a topic today that's surprisingly common, um, dual diagnosis.
Hmm.
And you've brought us some really interesting source material. I got to say, even I was a little taken aback by some of the statistics. We're talking about millions of people dealing with both a mental health condition and a substance use disorder at the same time. It's like if you took the entire population of New York City, that's how many people are facing this challenge.
It really highlights how connected our mental and physical well-being truly are. And yeah, it's a topic that deserves way more attention than it often gets.
Absolutely.
Yeah,
So let's define dual diagnosis right off the bat, just so everyone's on the same page.
sure. When we talk about dual diagnosis, we're essentially talking about someone who has both a mental health disorder, this could be something like depression, anxiety, things like that, and a substance use disorder occurring at the same time.
And it's not just about the numbers, right? It's about the real people, the real human stories behind those statistics.
100%. And that's what makes this deep dive so important because it's not always a simple case of this caused that. It's often this really complex kind of
Yeah,
intertwined.
like a tangled up mess.
Exactly, like a tangled up ball of yarn. Sometimes, you see, mental health challenges can lead someone to substances as a way to cope, to numb the pain, to escape difficult emotions.
So someone with, say, really bad anxiety might turn to alcohol to try and quiet those thoughts.
Precisely. Or someone might be struggling with undiagnosed PTSD and they use substances to try and block out traumatic memories. But then on the flip side, substance use itself can actually make existing mental health conditions worse or even be the trigger for new ones, which then creates this really vicious cycle that's very, very hard to break.
It's like a chicken or the egg thing, which came first, isn't always clear. And sometimes it's not even the most important question.
You hit the nail on the head. And understanding that complexity is really the first step towards effective treatment. Because if we're not addressing both sides of that coin, then we're only really solving half the problem.
And the source material really emphasizes that, right?
Mhm.
Like treating mental health and substance use disorders separately is kind of like putting a Band-Aid on a broken bone.
Mhm.
Yeah, it might offer some temporary relief, but it doesn't address the root cause.
Exactly. It's like a Band-Aid on a broken bone. That fragmented approach, it can lead to all sorts of problems. Conflicting treatment plans, medications that interact badly with each other, and ultimately it just increases the risk of relapse.
And we have to remember, that's not just a statistic. Those are real people, real families, who are grappling with the consequences when those two things aren't addressed together. And speaking of families, the source material also talks about the impact dual diagnosis has, not just on the individual, but on everyone around them. It's not just the individuals who suffers.
Absolutely not. Families often end up carrying a tremendous weight, both emotionally, physically, even financially. Imagine the stress of watching a loved one battle addiction while knowing that they're also trying to cope with a mental health condition that could be fueling those very behaviors. It's heartbreaking. It's exhausting.
And that's why we're doing this deep dive.
Yeah.
We're not just talking about individual struggles here. We're talking about families, communities. The ripple effect is huge.
It is, and it's important to understand the common culprits, the specific mental health disorders and substances that we often see in dual diagnosis cases. Now, it's not about labeling anyone. This is about recognizing patterns and understanding what we're dealing with here.
Right, like sort of getting a lay of the land. So when we talk about mental health disorders that frequently show up in dual diagnosis, what are we talking about? What are some of the usual suspects?
Well, we see a really wide range, but some of the most common ones include depression. And, depression can manifest in so many different ways: deep sadness, loss of interest in things you used to enjoy, feelings of hopelessness. Then you have anxiety disorders, and that's a whole other category. It can be generalized anxiety, panic disorder, PTSD.
And PTSD, of course, often comes from experiencing or witnessing something traumatic, which, like we were talking about earlier, can lead people to self-medicate with substances.
Exactly. And we can't forget about bipolar disorder. This is a condition where people experience these really extreme shifts in mood, energy, and activity levels. And these swings, they can be incredibly disruptive. And sometimes people turn to substance use to try to manage those really intense highs and lows.
Okay, so we've got depression, anxiety disorders, bipolar disorder. That's already a pretty significant range. What about the substance use side of things? What are the most common substances that we're seeing in dual diagnosis?
Again, it's a really diverse spectrum. We see everything from alcohol, which I think sometimes gets overlooked, but it can be just as addictive as any other drug, to opioids, which includes things like heroin, but also prescription painkillers. Stimulants like cocaine and methamphetamine are pretty common too. And then there are benzodiazepines, which are usually prescribed for anxiety, but they can also be highly addictive.
So many different substances, so many different mental health conditions. It really does feel like opening a puzzle box with 1,000 pieces. And that's got to be where the idea of integrated treatment comes in, right?
Exactly. Treating these conditions separately is like, well, it's like trying to read a book with half the pages ripped out. You're not going to get the full story.
Mm.
Integrated treatment, on the other hand, it's about recognizing that all those pieces are connected.
It's about connecting the dots. Seeing that someone's addiction might be completely intertwined with their anxiety or their depression but what does that actually look like in practice? When we talk about effective integrated treatment, what are the key parts?
Well, think of it like, a roadmap to recovery, right?
Right.
And there are some really important stops along the way. First and foremost, you have to start with a thorough assessment and diagnosis. And this isn't about just giving someone a label.
Right, it's not about putting them in a box.
Exactly. It's about really digging deep and uncovering their unique story. What's their history with mental health? What are their patterns of substance use? How are these different factors impacting their life on a day-to-day basis? What does their life actually look like?
So no two treatment plans would look exactly alike.
Absolutely not. Every single person is different. They bring their own experiences, their own challenges, and effective treatment recognizes that. So once we've got a clear picture of their needs, then we can start looking at different therapeutic interventions.
Okay, so we're talking about therapy, but there are so many different types of therapy out there. Where do you even begin?
That's where the expertise of the treatment team really comes in. They're going to carefully select therapies that have, evidence behind them, therapies that have been shown to work and that are specifically tailored to that person's needs.
So they're not just pulling something off the shelf. It's very personalized.
Exactly. One approach that we see being really effective for both mental health and substance use disorders is cognitive behavioral therapy, or CBT. Have you heard of CBT?
Yeah, CBT. It's about changing the way you think, right?
Yeah, you got it. CBT focuses on identifying and changing those negative thought patterns and behaviors that kind of feed into that cycle of addiction and mental health challenges. For example, someone with dual diagnosis, they might have these thoughts like, I'm a failure, I'm not good enough. And these thoughts can lead to these really overwhelming feelings of hopelessness, which can then fuel substance use as a way to try and cope. CBT can help challenge those negative thought patterns and develop healthier ways of coping.
So instead of reaching for a drink or a drug, CBT could give them the tools to sort of manage those difficult emotions in a healthier way.
Exactly. And then another really effective approach is called dialectical behavior therapy, or DBT. It's kind of like CBT's cousin. DBT also incorporates mindfulness and acceptance techniques, which can be super helpful for managing those really intense emotions and urges that, often go hand in hand with dual diagnosis.
Giving them the tools to work through those really, really tough moments when that urge to use substances is the strongest.
Yes, exactly. And we can't forget about motivational interviewing, or MI. MI is all about empowering individuals to find that motivation within themselves to change.
Oh, I like that. So it's less about telling someone what they should do and more about helping them figure out their why, their own personal reasons for wanting to change. I can see how that would be really powerful. What about medication? Does that play a role in integrated treatment?
It definitely can. Medication management can be a really important part of the treatment plan, especially when it comes to managing the symptoms of mental health conditions or helping someone through withdrawal or even managing cravings. But it's not as easy as just, here's a pill, everything's going to be fine.
Right, because you have those two different but connected things going on at the same time.
Yeah, exactly. It requires a lot of careful consideration, like, are there potential interactions between different medications? Are there side effects? And then it requires constant monitoring to make sure the medications are working and that they're safe.
It's about finding that sweet spot, right? Where medication is used to support the person's overall well-being without creating a whole new set of problems.
Absolutely. But it's important to remember that integrated treatment, it's not just therapy and medication, it goes beyond that. It's about recognizing the importance of support systems in someone's long-term recovery.
Because recovery, it's not a solo mission.
No, not at all. It's about understanding that the individual is part of a larger system. Their relationships, their support network, all of that plays a role. And that's one reason why family therapy can be so impactful. It provides that safe, structured space for families to work through conflicts, to repair those relationships that might have been strained, and to build that united front. And support groups like Dual Recovery Anonymous can be really powerful too.
Because just knowing that you're not alone in this, that other people get it, that can make a world of difference.
Huge. And then you have peer specialists. These are individuals who have walked their own journey of recovery and can offer guidance, support, hope. And finally, we can't forget about case management, which is essential for helping people navigate what can be a really complex system of treatment and resources.
It's like having a guide, someone to help them figure out all the ins and outs of treatment, maybe connect with housing support, employment support, all of those pieces.
You got it. Integrated treatment recognizes that true recovery, it's holistic. It's about addressing all those different aspects of a person's life, not just their mental health and substance use. It's about empowering them to rebuild their life.
It all makes sense. But I imagine for someone who's maybe hearing all of this for the first time, trying to actually find the right program could feel overwhelming. Like, where do you even start? How do you know if a program is truly equipped to handle something as complex as dual diagnosis?
It's a great question, and it's one we hear all the time. It's like, okay, this all sounds good, but how do I actually navigate this? Well, the first thing I'd say is look for accreditation. You want a program that's accredited and licensed specifically for dual diagnosis treatment. Don't be afraid to ask that question right up front.
It makes sense, right? You wouldn't go to like a heart specialist if you had a toothache.
Yeah.
You want someone who specializes in exactly what you're dealing with.
100%. And speaking of specialists, you want to look at the treatment team itself. Is it a multidisciplinary team? Are there psychiatrists, psychologists, addiction specialists on board, maybe even a certified peer specialist, someone who has that lived experience, who's been there themselves?
So it's not just about the program as a whole, but the actual people within that program.
Exactly. You want to make sure it's a good fit. And speaking of fit, don't be afraid to ask about their therapeutic approach.
Yeah.
Do they use those evidence-based therapies we were talking about earlier, like CBT, DBT, MI?
It's like checking if a restaurant uses fresh ingredients. You want to know what you're getting.
Right. You want the good stuff. And just as important are individualized treatment plans. Cookie-cutter approaches, they rarely work when it comes to dual diagnosis. Every single person is unique.
So what works for one person, even if they have the same diagnosis as someone else, what works for one might not work for another.
You got it. And another important thing, don't be shy about asking about the range of services they offer. Is it comprehensive? Do they offer detox services if that's something that's needed? What about therapy, medication management, aftercare planning? All of those things should be part of the picture.
Because it's about what happens after the initial crisis has passed, right? Setting people up for long-term success.
100%. And don't underestimate the importance of family involvement. Programs that include family therapy, family support, those can make a world of difference.
Because, like we said, recovery impacts the whole family system, not just the individual.
Absolutely. And actually, the source material we looked at included some really practical advice for anyone who's in that position of looking for a program. They had this whole list of questions to ask, like, how do you diagnose dual diagnosis conditions? What specific types of therapy do you offer? Do you do individualized treatment plans? Stuff like that.
It's like having a cheat sheet for one of life's toughest exams.
That's a great way to put it. And it's your health or the health of someone you love, so don't be afraid to advocate for what you need. Ask those tough questions.
Don't be afraid to say, this is what I need to get better.
Exactly.
You deserve a treatment program that gives you hope, that sees you, the whole you.
Absolutely. 100%.
Well, we've covered so much ground today, haven't we? The ins and outs of dual diagnoses, the challenges, but also the hope that integrated treatment offers. And I think that's what I'm taking away from this deep dive, that recovery is possible.
It absolutely is. It's not always easy, but with the right support, the right resources, and most importantly, I think, a belief in themselves, people can and do recover from dual diagnosis. It's about taking that first step, reaching out for help, and remembering that you don't have to go through this alone.
And for anyone listening who's feeling lost or overwhelmed, where can they turn for that first step?
Oh gosh, there are so many incredible resources out there. I always say, start with your doctor, a mental health professional. There are tons of organizations that are dedicated to supporting people with dual diagnosis. SAMHSA, the Substance Abuse and Mental Health Services Administration, that's a great resource. They actually have a national helpline.
So help is always available.
24 hours a day, 7 days a week. You are not alone.
And on that note of hope and resilience. We'll wrap up this deep dive into dual diagnosis. We hope this episode has given you a better understanding of just how complex this issue is and, most importantly, given you a sense of hope. Recovery is possible. So until next time, keep asking those questions, keep learning, and keep the conversation going.